This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how to tell if you have a hip labral tear. If you like this video, we put out new content weekly, so please like and subscribe. So a hip labral tear. So a hip labral tear, basically your hip is a ball and socket joint, and around the socket part there's this kind of rubbery layer called a labrum. It helps with the joint biomechanics and give good suction on the joint to kind of lubricate it with synovial fluid. Anyways, sometimes people have injuries where they tear their labrum, meaning that instead of just a solid bumper around, part of it has a little cleft or a little part that's torn. This can happen playing sports, and more happens in a younger population. If someone's much older and has growing pain like that, then it's usually hip arthritis. But so if you have a hip labral tear, you'll have pain right in your groin. And it may hurt when you do any sort of activity where you lift your hip all the way up or kind of turn it in. So if you're lying on your back and you pull your hip all the way in and then kind of turn it inwards, that's usually the test that we do to determine if someone has a hip labral tear. So again, if you have pain right in your groin, hurts when you kind of do activities with it that are more active. And if you lie on your back and put your knee into your chest and turn it and you get a lot of pain, you might have a hip labral tear. So how else can you tell? X-rays aren't really going to show it. A CT scan's not really going to show it or won't show it. An MRI will show it, but you have to get the right type of MRI. You need an MRI of your hip with contrast, meaning that they need to take a contrast in a needle, inject it into your hip, and then send you into the MRI machine, and that'll definitively show whether you have a hip labral tear. Sometimes you can try and do therapy or an injection for the tear, and it may calm it down so the tear stops spreading. But if it's really symptomatic, a lot of people end up going on to surgery where they will actually repair your labrum through something called a hip scope. Normally you can't walk for 6 weeks after that, or you can't bear weight, and then you have therapy afterwards. So it's a fairly significant surgery, but well advanced from what the surgery used to be, which is where they used to actually slice your whole hip open and go in, and it was a lot. Now they can do it all through scopes, even though it's a pretty significant recovery. So just to summarize, to tell if you have a hip labral tear, you have pain right in your groin, hurts kind of with activities. If you lie on your back and rotate your hip inwards, it'll hurt, and you might find that it's just not getting better. If you have all those things, then you might have a hip labral tear. So I hope I was able to answer your questions about how to tell if you have a hip labral tear. If you have any questions I didn't answer, feel free to leave them in the comments below. But I can't really give you medical advice about your condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.